In total, in the intention to treat analysis, there were 3,273 patients who were randomised. All of the patients received either CAPOX or FOLFOX chemotherapy treatment. The choice of chemotherapy was at the choice of the clinician rather than being randomised. But once we knew that the patients were eligible and which chemotherapy they were having, then they were randomised to have either 3 months treatment or 6 months treatment. The results of the study showed that, first of all, there were more adverse events in patients who had 6 months treatment compared to 3 months treatment. That was across all side effects, but notably diarrhea and especially peripheral neuropathy, where patients with grade 2 or above peripheral neuropathy, which is clinically significant, there were statistically more patients having more peripheral neuropathy with 6 months treatment. With 3 months treatment it was 13%, and with 6 months treatment it was 36%. So that was a significant difference and almost tripling of the incidence of peripheral neuropathy. In terms of the results, the primary endpoint was disease-free survival, and 5-year disease-free survival with 3 months treatment was 80.7%, and 5-year disease-free survival with 6 months treatment was 83.9%, an absolute difference of 3.2%. If you look at the hazard ratio was 1.17, and the upper limit of the confidence interval was 1.31, which crossed the non-inferiority margin of 1.2, which meant that overall we were unable to show non-inferiority for 3 months treatment compared to 6 months treatment.